right, so we are live here. Hello, everybody. Good evening or good morning, depending on where you're tuning in with us. I'm Hillary Romke. I'm the program manager for the Cutaneous Lymphoma Foundation, and you are tuning in tonight to our webinar focusing on skincare. So let me get my PowerPoint up here. So tonight we're going to be discussing skincare, super hot topic. I'm sure everybody is interested to hear what we're talking about. We're going to be doing sort of an overview, talking about a little bit of everything here tonight. Before we get started, I just want to offer a brief but heartfelt thanks to our corporate partners and our individual donors. Without you, we certainly couldn't make these programs possible. So thank you so much for your support. Tonight we have Chiado. Caitlin is a certified registered nurse practitioner with the University of Pittsburgh Medical Center's Department of Dermatology. She works with Dr. Oleg Akolov, director of the Cutaneous Lymphoma Program at UPMC. Caitlin received a master's degree in nursing from Duquesne University in Pittsburgh and is certified by the American Academy of Nurse Practitioners as a family nurse practitioner. Thanks so much for being here tonight, Caitlin.
Thank you for having me.
Yes, we are so excited to have you. Just a couple of housekeeping announcements before we get started, and then I'll turn things over to Caitlin because I know we're all eager. Tonight, if you have any questions during the presentation, if you would please submit them into the Q&A icon at the bottom of your screen. You can just open it up, type in your question, and we will get to questions as time allows. Please try not to put questions into the chat. That way your question won't sort of get lost. Let's see, the program will be recorded. So if you would like to watch it again or send it to somebody else, it will be available on our website under live event videos within about a week of the program. Also at the conclusion of our program, we're going to be doing a program survey. So if you wouldn't mind participating, that will pop up on your screen, just a couple of questions of feedback. So with that, I'm going to turn things over to Caitlin to get started here. Thank you so much, Caitlin.
Thank you, Hillary.
Yes.
Get my slides up here.
I'm going to turn my video off.
Okay. All right. Hello, everyone. As Hillary said, my name is Caitlin Chiado. I am a nurse practitioner with the Department of Dermatology at UPMC in Pittsburgh. I work with Dr. Oleg Akolov, director of the Cutaneous Lymphoma Program here. But prior to accepting my current position, I actually worked as a nurse on the unit where Dr. Akolov, most of his cutaneous lymphoma patients that need infusions are treated on that unit. So I have a lot of firsthand experience helping patients with cutaneous lymphoma manage their skin problems. I'm just absolutely thrilled to be here tonight. I believe this topic is going to be super helpful to patients with cutaneous lymphoma and even patients with just sensitive skin or dry skin like myself. An understanding of appropriate skincare is absolutely essential for all patients diagnosed with cutaneous lymphoma, and it's pretty simple. By making a few small changes in your daily self-care habits, you can make a significant impact in the way you feel, the way you look, and just the way your daily life goes about. So let's get started. I have a few simple goals tonight. The first is to briefly describe the function of healthy skin, and then I'm going to explain how cutaneous lymphoma can disrupt skin's function. Finally, I'm going to go over a few simple recommendations for optimizing the condition of your skin at home. For the purposes of our discussion today, the two most important layers of the skin to learn about are the epidermis and the dermis. This top layer here, you can see, is called the epidermis. It is your skin's protection from the outside world. For patients with healthy skin, you can think of the epidermis as kind of like a raincoat. It's resistant to water, it resists damaging chemicals, and it defends the rest of your body from microorganisms like bacteria and fungus. Germs should slide off your epidermis like raindrops on a raincoat. The dermis, right here, is the layer just below the epidermis. It is the thickest layer of your skin, and it assists in thermoregulation, which allows your body to maintain its temperature, even when the temperature of the outside environment is very different. Therefore, you can think of the dermis as an important part of your body's internal thermostat. Cutaneous lymphomas can be categorized into two groups, T cells and B cell lymphomas. And unlike most other forms of lymphomas, people with cutaneous lymphoma have a cancer of the lymphocyte cells that develop mainly in the skin. So, if you have a cancer of cells in your skin, how does that affect your skin's ability to function properly? One of the first things a patient with cutaneous lymphoma probably notices is discomfort. The skin can become dry and scaly. Many people experience itch, which at times can be severe. And the skin is also prone to redness or irritation. Besides being uncomfortable, skin affected by disease is also more penetrable. Remember, in healthy skin, the topmost layer of the skin, the epidermis, serves as a protective raincoat. But skin that's affected by cutaneous lymphoma is more penetrable, like a raincoat with holes in it. Secondary skin infections are not uncommon, as bacteria will take advantage of their ability to enter the epidermis. Additionally, skin affected by disease may find it difficult to appropriately regulate temperature. Some patients with cutaneous lymphoma develop cold intolerance, which no matter how many sweaters or blankets they pile on, they never quite feel warm enough. Conversely, some patients with cutaneous lymphoma may lose the ability to sweat, which makes exposure to extreme heat pretty dangerous. Your healthcare provider will be prescribing medications or other therapies with the goal of improving the condition of your skin. But it is equally as important that you practice good skincare habits at home. If you do, you can hope to improve the dryness, scaleness, scaling, redness, ability to heal wounds, and also improve your self-image. How you look often affects how you feel. In addition, you can hope to reduce itch and pain and ultimately prevent infection. So we're going to start at the beginning. Bathing. It's what everyone thinks of first when they think about taking care of themselves, taking care of their skin. The most important rule of thumb here is to limit shower and bath times to just 10 minutes once a day. If you can get away with bathing just once every other day, that's even better. Hot water will dry out your skin. And remember, dry skin is itchy skin. So try to use lukewarm or warm water instead. I know that's easier said than done, especially if you live in a climate like Pittsburgh in February. No one wants to be taking a lukewarm shower, but I promise too much of the hot water really does dry out your skin. Soap can also dry out your skin, so consider cleansing with just plain water and skipping the soap. When you do need soap, try not to use too much, and be sure to thoroughly rinse the soap off before you get out of the shower. There are a lot of soaps out there. How do you choose one that's going to be nice to your skin? Look for something that's gentle and without fragrance. In our clinic, we often recommend brands like Cerave, Cetaphil, and Aveeno. There are extra points if the bottle says sensitive, gentle, or National Eczema Association accepted on the label. I think you can see my pointer right here, this little emblem, the blue one on the Cerave bar. That is the National Eczema Association accepted label, always a good sign. Keep in mind, sometimes they will hide fragrances, even on products that say that they're meant for sensitive skin. I was looking through my little collection of samples, found one that's from a relatively well-known, trusted brand. It said it was for sensitive skin, and I opened it up and definitely had perfume in it. It smelled great, but probably not the best choice for someone with cutaneous lymphoma or sensitive skin. Okay, after bathing, when you're done, pat your skin dry with a clean, soft towel. Don't scrub. Again, irritation of any kind can worsen itch. After patting yourself dry, apply moisturizer right away. I tell my patients that it helps if their skin is still slightly damp when they're applying moisturizer. We call this the soak and seal technique. By applying your moisturizer right after you are done bathing, you help to trap or seal the extra hydration into your skin. Now, sometimes patients will complain that they have a hard time getting the moisturizer to fully absorb if they put it on when their skin is still damp. That's okay. Rub the moisturizer in gently, then wrap yourself back in your towel or your bathrobe and do something else for a few minutes before you get dressed. Comb your hair, brush your teeth, then get dressed. Oftentimes, the moisturizer will be better absorbed if you give it a little extra time. Okay, moisturizers. Again, how do you pick one? There's so many when you walk into Target or the drugstore. It can be a little overwhelming. Just like with soap, start by looking for something that is gentle and fragrance-free. Over here, you can see that National Eczema Association accepted label again on this bottle. And on this one, you can, after you find something that's gentle and fragrance-free, you can look for keywords like lotions, creams, or ointments to help guide your decision. So on this side, we have lotions. Lotions are typically high in water content. If you look at the back of the list of ingredients, water is either the very first or the second ingredient on the list. They feel lightweight when they're applied. They can be soothing in the short term, but you might find that you have to apply them more frequently than other options to notice a continued benefit. On our other side here, ointments are in contrast made of primarily oil. They therefore have a greasy texture when they're applied. For lasting benefit, these are typically your best option, but some patients tell me that the texture bothers them. So while ointments like the Aquaphor right here are the most effective of the three choices, they will only work if you actually use them. Creams here in the middle are made from a more equal combination of water and oil. So in a way, you kind of get the best of both worlds. They're thicker than lotions, but less greasy than ointments. So creams are a great compromise for people that are constantly avoiding applying their ointment because of the texture. For example, I have a couple of patients who will say things like, I didn't apply the ointment today because I didn't want to get it on my nice shirt, or because I don't want my hands to be greasy while I'm working. If that's you, then I always recommend using cream like this Vanna cream during the day and then switching to the ointment like Aquaphor at night. Pro tip, ask your healthcare provider if they have any samples next time you're in the office. That way you can test drive a product before you go to the store and commit to a full size. Few more key words here that you might see on a moisturizer product label. If they're talking about occlusive ingredients, these create an oily barrier and they seal water into the skin, a lot like ointment or the Aquaphor. Humectant draws water into the skin, and emollient ingredients reduce shedding and bind the skin together. Okay. You have your perfect soap, you have your perfect moisturizer, you took a shower, it was warm, not too hot, and now you're getting ready to put that perfect moisturizer on from head to toe. This is the right time to perform a skin self-assessment. Like we discussed earlier, your skin is your first barrier to the outside environment. If there are any weak spots in your defense, you want to know about them. Take the time to truly examine every inch of your skin, especially areas that you don't often look at, like your feet and your lower legs. Having cutaneous lymphoma might make your skin more fragile, and you might experience an injury without even realizing it. If you do find an injury, monitor it closely for increased redness, warmth, pain, and drainage, all of which are signs of an infection. Additionally, take extra precaution to avoid injuries to your skin. Keep your finger and your toenails trimmed short and clean so you don't get carried away while scratching and tear your skin. On a similar note, don't use tools to scratch. I've seen all sorts of terrible injuries that when I ask about them, well, you would be surprised by what people tell me they were using to get their scratch on. No back scratchers, no forks, no door frames, nothing like that. Do not walk around your house barefoot. Always wear shoes with a sturdy sole to protect your feet. And be careful also when removing tape or band-aids from your skin because the adhesive can tear at delicate skin. Another little pro tip, if you were at the doctor's office, they drew blood, they took out an IV, and they put a bandage on with tape, always ask if they have an adhesive remover that they can use to take the tape off when you're done with the bandage. A lot of times the nurses will have a little vial or a little wipe that contains a slightly oily solution meant for dissolving adhesive on the skin. When I was a nurse, I would always describe this to my patients as Goo Gone, but for people. One of the brands that we used pretty often was called Detach-All, but I'm sure there are a lot of other options out there. You could probably pick them up at your drugstore. I would just ask the pharmacist when you go. Okay, let's talk a little more about itch. Itch is one of the most common complaints that our cutaneous lymphoma patients report. And unfortunately, if you don't stop what is called the scratch itch cycle, the symptoms can intensify. So what do we mean by the scratch itch cycle? When something on your body is itchy, your first instinct is to scratch at it, right? But scratching only provides fleeting relief, and often the itch is even worse afterwards. The more you scratch, the worse the itch gets. So the more you scratch and the worse the itch gets. Before things get out of control, we want you to stop the cycle. How do you do this? Instead of scratching, try one of these interventions instead. Not all of them may work for you, but through trial and error, you will hopefully find something that helps. We're going to go over all of them in detail. First one on our list is oatmeal baths. Oatmeal has been used for centuries as a calming agent to relieve skin itch and irritation. The first ready-to-use colloidal oatmeal product became available in 1945, and today there are numerous self-care products available containing oatmeal. For example, Aveeno makes this skin relief moisturizing lotion. I'll show you right there. It contains triple oat complex. And in this one by Aveeno, oat flour is listed as one of the ingredients. It's a cracked skin relief balm. I'm hoping you can see it there. Why oatmeal? Oatmeal's high concentration of starches provides a protective and water-holding property. The phenols found in oatmeal provide an antioxidant and anti-inflammatory effect. And finally, oatmeal contains something called saponins, which help to cleanse the skin. So this kind of makes oatmeal a bit of the superstar ingredient in the world of skincare. It cleans, moisturizes, protects, and soothes. Drying your own oatmeal bath at home is relatively straightforward. What you want to do is buy a big tub of old-fashioned oats at the grocery store, like you can see right here on our slide. Keep in mind, these are not the same thing as instant oatmeal, which contains a lot of extra ingredients that you do not need in your bath, like flavorings, sugars, and salts. We don't need you swimming in a pool of Quaker's peaches and cream oatmeal. Okay, next step, grind the oats into a fine powder using a coffee grinder or a food processor. The ground oats should be fine enough that they easily dissolve in warm water. Fill your tub with warm water and add between 1/2 and 1.5 cups of the ground oatmeal. I've heard some people recommend first tying the ground oats in an old pantyhose before adding the whole thing to your tub, making it kind of like a tea bag and a teacup. This supposedly contains a bit of the mess while still allowing the benefits of the oatmeal to infuse throughout your tub. Soak in this for about 10 minutes, then pat your skin dry with a towel and apply moisturizer. You don't need to use soap or rinse after an oatmeal bath because, like we mentioned before, the saponins give it a cleansing property. If you're not in the DIY mood, do not despair. You can buy oatmeal bath powder ready for use at most drugstores. This one is made by Aveeno. The instructions say, slowly sprinkle packet of colloidal oatmeal directly under the faucet into the tub or container. Stir any colloidal oatmeal settled on the bottom. You can see it right there. Easy enough. Next idea is antibacterial baths. We all have bacteria living on our skin, but patients with cutaneous lymphoma often have a higher load of bacteria and may be what we call super infected. By soaking in an antibacterial bath a few times per week, you can decrease the level of bacteria living on your skin, which will in turn hopefully decrease your itch. The process is super simple. You fill your tub with warm water, and you're going to add either white vinegar or bleach. Now, the amount you add is important. You don't want to overdo it. Remember, the rule of thumb is add 1 cup for a full tub or a half cup for a half of a tub. Soak in this for 10 minutes, then pat yourself dry and moisturize. Keep in mind, if you are using bleach, you want to use white towels or really old towels. I don't want anyone getting mad at me at home because they tried it and they ruined a good colored towel with bleach spots when they were drying off. Also, I know that when I make this suggestion, patients are often very surprised. It sounds really harsh, but think of it like swimming in a pool with chlorine in it. It's kind of the same idea. With the right concentration of additives, not too much, it should be really helpful. Okay, next, on to cooling lotions. Frequently, our patients find that using an over-the-counter topical anesthetic will provide some temporary relief from their itch. Our clinic usually recommends Sarna, which contains camphor and menthol, or Sarna Sensitive, which contains pramoxine. Both options can be purchased in most drugstores without a prescription, and they are steroid-free. They also provide this cooling sensation when they're applied directly to your skin. The best way to describe the sensation of Sarna is to liken it to the cooling sensation you feel when you chew peppermint gum or use peppermint toothpaste. I like these options because they're easy to take with you when you're out and about. If you're at Target, you can't exactly draw yourself an oatmeal bath or a bleach bath, but you can apply a little bit of the Sarna lotion. Many of my patients will take a small plastic container of these lotions in their purse or their pocket so they have something to fall back on, something to use when itch strikes. Okay, on to wet wraps. Of all my suggestions today for improving dry skin, this is far and away the one that I have seen my patients have the most success with. Unfortunately, it is also the suggestion that people are the most resistant to. When I describe the process, many people think that it sounds really uncomfortable or they are concerned by the time commitment. But once I finally convince people to give it a try, I will say they are all hooked. The very first step is to collect all of your supplies. You will need a basin or tub of clean, warm water, moisturizing ointment or a topical steroid prescribed by your healthcare provider, clean dressings, old blankets or towels, and an old shower curtain or similar piece of plastic. Lay that piece of plastic over the surface where you plan to sit or lie. Some of my patients will throw it over their recliner in the living room, some put it over their mattress. Then you want to soak your dressings in the tub of warm water. For dressings, you can use cotton t-shirt, thin pajamas, long underwear, or old sheets. Wring the dressings out. They should be damp, not soaking wet. Next, apply your moisturizing ointment, or your prescribed topical steroid. For patients using an unmedicated moisturizing ointment, I usually recommend applying this liberally everywhere from the head down. I often tell my patients that they should be so greasy at this step that they could go slip and sliding without the slide. Then wrap your body in the damp dressings. For patients that find the damp dressings a little bit chilly and off-putting, you can always try throwing them into your clothes dryer for a few minutes to warm them up before you put them on. But remember, you still want the dressings to be damp, so don't dry them for too long. Last but not least, put on a pair of thick, dry pajamas or pile on the blankets. Just relax. That's the next step. Sit or lie in the dressings for at least 1 hour, longer if you can manage it. Think of yourself kind of like a chicken breast that you're marinating for dinner. The longer the better. You are moisturizing in this ointment. Watch some TV, listen to music, even better, take a nap. Some patients will even actually apply these dressings before going to bed at night, and they don't remove them until after they wake up the next morning. When the treatment is complete, remove the dressings and dry them. You can either hang them up to air dry or throw them in your dryer, and you can reuse them several times before you actually wash them in the washing machine. If you are performing this treatment on your whole body, you might require a little assistance from a family member. Sometimes I help patients with this when they come in for their treatments, and by the end of the application, they look like a mummy where all you can see is their face poking out from all of the dressings and blankets. If you can't manage your entire body at one time, maybe you're doing this at home by yourself, you can switch different parts of your body from day to day. So for example, on Monday, you might apply it to your legs, and on Tuesday, you might apply to your torso and your arms. I know the procedure sounds uncomfortable, and a lot of patients worry that they will get cold while sitting in damp dressings, but the trick is to really pile on the warm, dry layers. I think you will be surprised by how easy a process it truly is, and by the benefit that you get from it. Okay, you've been moisturized. Now it's time to get dressed for the day. Choose clothing that is loose fitting, nothing too tight, and choose things that are breathable fabrics like cotton, no leather pants. Avoid scratchy or rough materials like wool, and use laundry detergents on your clothing that are unscented and dye-free. I have this box of samples that we keep at the clinic. The entire box is called the Free and Gentle product. Tide makes these pods, Free and Gentle pods. This is Downy Free and Gentle fabric softener. And then for dryer sheets, when you throw your clothes in the dryer, Balance has these Free and Gentle Balance sheets, dryer sheets that you can use. Highly recommend. Finally, distraction techniques. Have a plan for when itch strikes, something to do that will take your mind off the itch. Go for a walk, prepare a healthy meal, work on a puzzle, play a game with a family member, listen to some good music. I know it is sometimes difficult to do, but if you get up and distract yourself from the itch, it often makes the symptom a little bit more manageable. Okay. We're going to talk a little bit now about just general skin care habits. Cold intolerance, I know I mentioned before, is something that patients with cutaneous lymphoma frequently complain of. So in your house, you want to focus on maintaining a warm, draft-free environment. Avoid exposure to extreme temperatures, not too cold, not too hot. Some patients experience an inability to sweat, which can make being out in really hot weather pretty dangerous. And make a habit of dressing in layers. A short sleeve shirt with a long sleeve sweater over top is always a good idea when you're going out and you're not sure what the temperature is going to be like at someone's house or a business, wherever you're going. During cold, dry months, use a humidifier in the areas of your home where you spend the most time. I live in Pennsylvania, and if you've never had the pleasure of being in Pennsylvania in February, As a general rule of thumb, the weather here is pretty nasty in February. Very dry, very cold. So I run a humidifier in my bedroom every single night during the winter months. You might also consider this trick if you find that your skin is irritated by the dry, air-conditioned air during the summer months when your air conditioning is running. Just remember to clean your humidifier regularly. You must be diligent to prevent the growth of harmful bacteria in the water reservoir. Clean the reservoir daily with hot soapy water and clean weekly with a solution of 50% hot water and 50% bleach. When I'm doing this at home, I'll fill the reservoir up with the hot water and bleach, and then I will put it on the base for about 10 minutes, let it sit there before I take it off and rinse everything really well. That part is just as important. You want to rinse everything super well. If you sniff inside, it should not smell like the cleaning solution that you used before you use it again. Okay, last but not least, let's talk about hands and feet. Of all the parts of our body we depend most on, our hands and feet are important for activities of daily life, like walking, driving, writing, typing, eating, etc., etc. Patients with cutaneous lymphoma can experience something called hyperkeratosis, or thickened skin on the hands and feet. The thickened skin can lead to painful fissures, which at times can make activity extremely painful. And then with that thickened skin, swelling of your legs and feet can put even more stress on your skin, which then further exacerbates your problems. If you experienced swollen extremities, elevate them on a pillow while resting to decrease edema. And if the problem continues, talk to your healthcare provider about using compression dressings like stockings or wraps. To prevent fissures, those cracks in your hands and your feet, try applying moisturizing ointment to your hands and feet at bedtime, then covering them with plastic saran wrap and cotton gloves or socks. This is the same idea as those wet wrap dressings. We want you to marinate in the ointment a bit like the chicken breast. But a very important word of warning, do not try to walk while wearing plastic wrap on your feet. Plastic wrap is slippery, and I don't want you to slip and fall. This dressing should only be used while you are resting in a chair or in a bed. You can also talk to your healthcare provider about using a product that contains urea. Urea is a keratolytic. It breaks down some of the proteins in your skin that allow calluses to continue to build up. Thick calluses, especially on your feet, are frequently to blame for heel fissures because the thick skin builds up and it's not as flexible as the softer skin beneath it. When you're walking or standing on your feet all day, that thick skin cracks. If you can remove the thick buildup, you will hopefully be left with a softer, more pliable skin beneath. Urea-containing products are available over the counter without a prescription, but your healthcare provider can prescribe a product with a higher concentration of urea if he or she thinks it's appropriate. If you do develop fissures, be sure to clean the fissures daily and monitor for signs of infection, like increased pain, redness, warmth, or drainage. If your fissures are especially deep or painful, try super glue. I know this sounds a little crazy, but super gluing fissures can decrease pain and increase dexterity, allowing you to carry on with your usual activities. Before gluing, clean the fissure with soap and water and then allow it to dry. Apply just a drop of the super glue, and then you're going to pinch the skin around the fissure, not the actual fissure, but the skin around the fissure so that it closes. Hold it for 60 to 90 seconds. The initial application can sting a little bit. It can be a little bit painful when you put the super glue into your fissure, which is likely already very tender. But I find that the pain very quickly subsides. If the glued fissure is on an area of your body that you wash frequently, you might have to reapply the super glue every few days. Do not peel the glue out of the fissure. This could cause further injury and pain. Allow the glue to fall off naturally as the fissure heals. And another pro tip, Be especially careful not to super glue your fingers together. Your skin is sensitive, so you only want the glue to be where you need it in the fissure. That stuff is strong. Okay, so we're going to briefly go wrap up. We're going to review what we covered this evening, and then we can open it up to some questions. In summary, when you're bathing, you want to bathe with lukewarm, not hot water and gentle, fragrance-free soap. And then you're going to moisturize immediately after bathing and then regularly throughout the day. You want to interrupt the scratch itch cycle with one of those interventions that we covered. And remember, consistency is key. Don't get frustrated if the first time you try one of these tips, you don't notice an immediate improvement or a night and day change in your skin. It takes a while and repeated practice of these habits before you will notice a real significant change. So patience, stick with it, and don't give up too early. Finally, I just want to thank my colleagues, Sue McCann and Dr. Ackloff, for helping me out with this presentation.
Thank you so much, Caitlin. That was awesome.
Thanks, Hillary.
Yeah. So we have a ton of questions, but we will,
Great.
We're going to just start off here and we will go as long as we can until the top of the hour, if that's okay with you.
Sure.
All right. So the first one we have is, and just a quick note to everybody, if you do have more questions, please just submit them not into the chat, but into the Q&A portion at the bottom of your screen. Okay, so the first question is, my husband often works outside and in extreme temperatures. His skin is dry, itchy, and flaky year round, and in winter it cracks and scabs. Is there an over-the-counter moisturizer that works, and do cracks or scabs on the skin need an antibiotic cream?
Okay. So my go-to recommendation for patients that have super dry skin is always a gentle ointment like Aquaphor. It's always what I recommend. And I recommend that you put it on frequently, especially after your skin gets wet. So every single time you wash your hands, put it on again and again and again. On top of that, you should be wearing protective garments to keep your skin from being directly exposed to the cold weather. So always wearing gloves, always wearing good socks, a hat, that kind of thing. You can try the super glue trick for the fissures. I don't always recommend topical antibiotics right off the bat, but if you notice early signs of an infection like increased redness, warmth, any drainage, those are definitely signs of an infection. So just use your best judgment. Like I said, I don't always recommend it, but if you're concerned for an infection, we typically use bacitracin at the hospital.
Okay, great. And it sounds like a key there too is just to continue reapplying and reapplying and making
Absolutely.
sure that skin doesn't dry out.
One other thing I thought of, Aquaphor can be greasy. So I don't know what kind of job your husband does, but if he's working with his hands, sometimes people don't like using ointments on their hands. If they're going to work, they're going to be using tools, they're going to be writing with pens, that kind of thing. So I personally like a brand called O'Keeffe's Working Hands. It's not for everyone, but I find that when I put it on, it's fragrance free, so that's good. But it's more of a tacky texture when you put it on your hands, so it's easier to grasp tools, write with your pen, whatever you might be doing. So that's another option too.
Great, thank you.
Yeah.
Okay, the sun has a positive effect on my husband's lesions, reducing the redness and appearance, but as I have had melanoma, I worry about his exposure. I know he should be using sunscreen, but one, does that reduce the benefit of the sun if he's wearing sunscreen? And two, should his sunscreen have zinc? It's a good question.
It is a good question. So absolutely, sun exposure does increase risk of other skin cancers like melanoma. It's a bit of a balance. Whenever Dr. Ackloff, who I work with, recommends sun exposure, he will tell patients to go outside when the sun isn't at its most powerful during the day, when it's not strong. So typically before 10 a.m. and after 4 p.m. If you're doing this, you should not be wearing sunscreen during that time, and you should be limiting your exposure to just 15 or 20 minutes. That's really all you need. And like I said, avoid the sun when it's at its strongest. Now, the doctors are definitely absolutely aware that there is a trade-off. So when they are prescribing natural sunlight, when they prescribe phototherapy, there is also that risk, which is why they do total body skin exams every time they see you, or regularly when they see you in clinic. They are looking for other lesions that are worrisome. If you do personally have a history of melanoma, typically they will not prescribe light therapy. They won't prescribe phototherapy. That's a contraindication, meaning they just don't do it, don't go well together. As far as sunscreen goes, zinc oxide is a great choice. It's what I use myself. It's a mineral. It's considered a physical barrier as opposed to other sunscreens which use chemical ingredients. I think as long as you apply it regularly, you know, it will rinse off in the ocean. It works really well. It's definitely a great choice. But if you're going outside for the purpose of getting a little bit of indirect sunlight for your cutaneous lymphoma, don't use sunscreen at that point.
Okay, great. Is there a topical medication stronger than clobetasol 0.5, but not as potent as nitrogen mustard for application to MF, CD30 positive lymphoproliferative lesions in patients being treated with brentuximab vedotin infusion and UVB light box? Sorry, that was a long one, so let me know if you need me to repeat any of it.
No, I think I got it. Yeah. So we're comparing clobetasol and Valchlor.
Yes.
So they are both topical medications, but they're actually from different drug classes. So it's a little bit like comparing apples and oranges. Clobetasol is a topical corticosteroid, whereas Valchlor is kind of like a topical chemotherapy. It's an anti-neoplastic agent. Can't really compare them. Clobetasol, they have different levels of potency, strength for topical steroids, and clobetasol is generally, well, 0.5% is considered super high potency. So it's in that top most potent, highest strength level. If you are concerned that you're still not getting the results from clobetasol that you wish, talk to your healthcare provider. I want you to talk to your doctor about this first. Sometimes the doctor will recommend putting an occlusive dressing on over the ointment. So if you have a lesion right here on your arm, you put the ointment on, and then you put a Band-Aid or some other plastic dressing over top to kind of hold the dressing, hold the ointment in place over your lesion. Mm-hmm. This kind of prevents it from rubbing off on your clothing or evaporating. It holds it where it needs to go. But like I said, clobetasol is already super strong as it is. So I want you to talk to your doctor first to make sure that it's an appropriate location to do that in.
Okay, great. Thank you.
Mm-hmm.
My dermatologist and his residents recommend Cerave products for skincare. They contain ceramides, which I know are protective for skin. They also contain parabens, which I know can interfere with hormone function, and I try to avoid. Is there a good alternative that is great moisturizer for sensitive skin and that does contain ceramides? And then he added, there is Cetaphil lotion for eczema that contains ceramides and is paraben free, but it doesn't contain as many ceramides.
Okay. So just to start off, parabens, for those of us who are not aware, parabens are something that are added to cosmetic and care products as a preservative. And they're not just in cosmetic products. You actually can find them in a lot of food products. And the reason they're added is they protect these products from contamination. So for example, you've got a big jar of your Cerave, and if you put your hand in, your fingers, even though you just wash them, probably have some sort of bacteria on them. Put it into your lotion 2, 3, 4 times, the bacteria is now in that jar, and it could grow uncontrolled just sitting in there, kind of like a petri dish. Mm-hmm. So the parabens are supposed to stop that growth and keep your product as clean as possible. So in a way, they do serve a good purpose. Now, there have been studies suggesting that these parabens can interfere with endocrine or hormone function, but the research is pretty controversial from my understanding. A lot of these studies are based on cell models or animal models like rats or mice. And with the animal models, I believe the parabens were tested at extremely high levels. So the doses were a lot more than you would ever come into contact with from just using Cerave lotion. And then on top of that, a lot of the effects reported in these animal studies they weren't able to replicate them or repeat them in studies that looked at human beings. Final point I want to make on this, with regard to preservative choices, because you do want a preservative in your product. You don't want it going bad on the shelf. Parabens actually seem to be the safer choice as far as preservatives go for patients with sensitive skin. Purely looking at it from an allergic reaction, sensitive skin standpoint, patients tend to not have responses to parabens. All that being said, if you're still not comfortable using parabens, fair enough. I personally use Vanicream at home, and it is paraben-free, dye-free. I think when I was showing the slide of the creams, it was the one right there in the middle, and it also has ceramides in it. So that's always a great option. I buy mine at the grocery store, and I think I saw it at Target there the other day.
Okay. And just piggybacking off what you said, Caitlin, should people be using like a tongue depressor or something else to scoop out from their jars instead of putting their hand in? Does that help cut down on any of that bacteria growth?
I mean, it's always a good idea.
Mhm.
I don't know that it's necessary because they put those preservatives into the products.
Okay.
Now, if you're sharing with someone else, I don't recommend, helping yourself. I mean, with COVID, no one really does that anyway, but I don't recommend sharing products, samples from, Sephora or wherever you might find products, Bath and Body Works, something like that. But yeah, if you're worried about it, or if you have an active infection that you know of, you can, but still, I think if you have an active infection and you're worried about contamination, I would probably just throw the product out at that point.
Okay. Great.
Yeah.
Do you have any recommendations for caring for dry or flaky, scaly skin, specifically on the face?
Sure. So a lot of the moisturizers that we went over can be used on your face. They're that gentle. I use the Vanicream on my face regularly. On top of that, you can talk to your doctor depending on what they see. Sometimes they'll prescribe a very mild, gentle topical steroid if they think that you need it. On top of that, those wet wrap dressings I was talking about, sometimes patients will do them on their face with like little pieces of clean gauze, which is kind of a funny thought, but it works for them. So just kind of depends how bad the dryness is.
Okay. And someone actually had just asked, does a wet wrap work on the face? So there you
Yeah,
go.
it does. Yeah. I mean, you want to be able to breathe, so don't cover up
Yeah.
your face completely. But yeah,
Right.
cheeks and forehead, I've had patients do that definitely.
Okay. Which do you apply first, the steroid cream or the moisturizer?
Sure. So when you're using any type of medicated cream, ointment, whatever your doctor gives you, you want to put that on first because that is when it'll be its most potent. You don't want to put it on in unless your doctor tells you to. Sometimes doctors have a good reason to recommend it, but you put the medication on first, let it absorb for 10-15 minutes, and then you can put your moisturizer on afterwards. If you put your moisturizer on first, it prevents as much of the medication from being absorbed into your skin, so it makes it a little less effective.
Okay. Someone said, my multiple plaques do not itch. Why is this when so many others have severe itch? Maybe just lucky.
That Yeah, that's a great question. The doctor that I work with, Dr. Aklov, will frequently tell me that these diseases don't read textbooks. That's one of his favorite sayings.
Mhm.
So, not everything's different. I have many patients that are technically diagnosed with the same disease, but they all look slightly different. So I wouldn't read too much into that. It's probably a good thing. But if you have questions about it, I would recommend talking to your dermatologist or your healthcare provider, whoever you see.
Okay. I periodically soak my feet for about 20 minutes in warm water. Is this useful to reduce dryness? Is there something I could add to the water that would help?
Absolutely. Soaking is great choice.
Mm.
You could also add the oatmeal if your skin is itchy, or even the vinegar or bleach. If you've got some fissures, this is a great way to clean your fissures before you put on your ointment, put on your super glue even. Just make sure that you dry them off very well at the end. And it's a great first step after you soak them for 20 minutes. We talked about the saran wrap with the ointment. It's a great first step, putting the moisture, the hydration into your skin, soaking, and then sealing it with some Aquaphor, and then further sealing it with some saran wrap or just plain cotton socks before you go to bed at night. I think it's a great idea.
Okay. For the antibacterial soak, is there another option rather than soaking the skin when one only has one localized stubborn itch area? And then they added spraying on the particular area with antibacterial formula. Would that work the same? Is that even an option?
Yeah, absolutely. We have patients that don't have baths. So, how can you soak in something if you don't have a bathtub? And that's what we'll often recommend afterwards, is that you make a little bit of the solution yourself in a clean spray bottle. Keep in mind the ratio is very small, maybe I think a teaspoon of bleach, depending on how big your spray bottle is. And then you just get into the shower, especially if you're using bleach. You don't want to be spraying it around and get, your bedspread or the carpet or anything like that. But get into the shower, spray where you need to spray, let it dry, and that often has the same effect.
Great. Thank you. Is Dove bar soap a good soap to use? If not, do you have a recommended brand of bar soap?
Sure. So Dove, I would have to look at the packaging. A lot of the products do have fragrance in them. So just check it out next time you're at the store. If you don't have a problem with fragrance, then, you know, good. But for people with sensitive skin, as long as I would check to make sure there's no fragrance in it, because typically Dove does have it. Um, Instead, I would recommend Aveeno, Cerave, or Cetaphil, something like that.
Someone else asked, do you recommend rosehip oil?
I have not had any experience with rosehip oil, to be completely honest with you. I don't know of any of my patients that use it, but I can look into it if the questioner wants to send me an email. I could definitely look into it.
Okay, thank you.
I'm going to
If
go back
okay,
to my main screen so that people can see my email again if they want to send me
oh,
an
thank
email.
you so much. You are so sweet.
There we go.
Thank you so much, Caitlin. Someone asked, if you don't have a bathtub, how can you do a bleach bath? Maybe a
I
swimming
would just
pool?
Yeah, I mean, a swimming pool could work, but definitely I would try the spray bottle instead. Stand in your shower and use that.
Okay. Are there any other ingredients besides fragrance or perfume that we should watch out for? And then they added any that have high or moderate toxicity, immuno-toxicity, endocrine disruption.
That is probably a list that we could go on and on and on. I know that there are many dyes in certain products, certain preservatives that I don't want to say they're toxic, but they might have a higher risk of causing some sort of allergic reaction, there probably is a higher risk of sensitivity if you use them. I couldn't even begin to start listing them all right now, but typically these products, these brand lines, the Cetaphil, Aveeno, Vanicream, just plain Vaseline, Aquaphor, these are across the board pretty standard recommendations for dermatologists. So if you go back to these and use them, I think it's a safe bet.
Okay, great. And just a warning, everybody, we have about 5 minutes left, so we'll get to as many as we can. If I'm using an ointment-based steroid, do I need to also moisturize?
So it depends where you are putting the ointment-based steroid. Now, ointment as a general rule of thumb, when the steroid's in an ointment, it's typically more potent than if it were in a cream or something like that. So you're probably not going to be using a steroid ointment everywhere. You're probably not going to be smearing it head to toe. But I do want you to use moisturizer head to toe. So just use the steroid ointment where you have the lesions, where your doctor tells you to apply it, and then everywhere else you should be moisturizing with. Absolutely.
Should you skip a day or two when applying topical medications to increase their efficacy? For example, clobetasol.
Sometimes doctors do recommend it for one reason or another. They call it taking a little bit of a holiday from treatment because your body is pretty amazing. It can build up a resistance or a tolerance to any type of treatment. So yes, sometimes the doctor will recommend that. I would talk to them about it first before you try it. On top of that, sometimes if the medication's too strong, they will recommend that you only use it 2 days a week, 3 times a week, that kind of thing.
Okay. What do you think of combining Vanicream with almond oil designed for skin? It can make the Vanicream easier to apply.
Sure. I have not used almond oil, but I think that as long as you've used it in the past and you have good experience with it, I don't see what it could harm. But yeah, like I said, I don't have one-on-one experience with almond oil.
Okay. So we have time for just one more question here. What brand of moisturizer is best? Is Lubriderm acceptable?
I don't know anything off the top of my head that's necessarily wrong with Lubriderm. I think if you have good experience with it, it's not a problem. If you have questions about any of these specific brands, it's always a good idea to take it with you to your dermatologist. You know, they know you best. They know the other medications that you're on, and they would be the best suited to look at the labels and tell you, okay, well, you know, this might not be the best choice for you, or yeah, keep using it. It's a great choice.
Great. Awesome. Thank you so much, Caitlin. This has been wonderful. We are so
Oh,
appreciative of your
good.
time and
I'm
your
so glad.
expertise. And thanks for giving us sort of a whole collective idea of the best skincare tips. So we're so appreciative. Um,
Absolutely.
thank you.
And
And
people can feel free to email me.
thank you so much. I'm sure you will get a lot of emails. That's so kind of you to offer. And for everybody else, I've launched a poll. If you wouldn't mind just giving us your feedback, we greatly appreciate it. And just before we sign off tonight, I did just want to let everybody know we do have 2 upcoming webinars focusing on research. The first one is going to be on Wednesday, March 3rd, and that's at 7 p.m. Eastern time. And we're going to be going over some topics regarding our research roadmap with members of our Research Advisory Council. And then also Dr. Akalov, who Caitlin has referred to, is going to be providing a research update for us on Thursday, March 25th, and that's at 6 o'clock Eastern time. So both of those are going to be wonderful, super informative research focused webinars. So please join us. And thank you again, Caitlin. So appreciative, so grateful for your time, and we hope to see you again soon. So thank you, everybody. Hope you have a wonderful evening or rest of your day, depending on where you are in the world. Be well, and we will talk to everybody soon. Thank you so much.